All right, welcome back, students. This is the second video of our podcast style guest talk with Kari, who is a recreation therapist as well as clinical educator. Yes, at Glenrose Hospital, working with a lot of people with their stroke and TBI, So I hope you finished watching the first video, and in the second video, Kari, I wanted to ask you a little more about the group of people you work with. So here goes. What types of leisure-related and recreation-related difficulties, maybe what we call constraints or challenges, do you observe among your clients typically?
Well, I think several. and again, it's very individual, right? Because you know the brain is such an intricate piece of us that and brain injuries happen in different parts of the brain, so they can have some physical challenges, so some hemiparesis, they can have some cognitive challenges, emotional challenges, all those things that, and I think I mentioned before too, even some behavioral challenges which impacts their social functioning. So across the board, and I think it's adjustment to the changes that they've experienced is another piece, right? I think, like I said before, we really take it for granted, our leisure activities, and it might be something that people haven't explored before or don't know what to do with the changes that are happening for them. So, and an awareness of some of the resources and adaptations that are available to them. So.
I have just only very limited interaction and experience with the people with their TBI. I've got just a few visits to their clinical and neuro-focused clinical in a previous institution. I had some of their talk with the professional who work with mainly with the folks with the TBI and all. But I was wondering, when you were in a last video, when you're talking about some education piece of leisure education, right, the explanation piece of it. Do you, I mean, again, I think it depends on individual, but do you tend to kind of face and encounter the need to kind of break it down a little more and in a certain way, one way or another? What kind of, modification, adaptation do you tend to utilize?
That's a really good question. So I guess, that is something that we look at, that can this person function in a group setting? And can they function in terms of, like if they have cognitive difficulties, can they understand? Can they communicate back with us to ask questions and clarify? Behaviorally, can they engage in a group setting without being disruptive? And so if those are some concerns, then we can look at doing things individually, right? Like having maybe more one-to-one, or working in some other areas to help them improve before they come into that class setting. I was going to say something else and I've lost it. I was going to say too, so people with communication difficulties, we partner as well with, like I said, our speech language pathology colleagues. So we've adapted some of our material to be aphasia friendly. So there's not so much information on the page, the font's a little bit bigger. Maybe we're looking at keywords. So we really do some supportive communication as well. So if we're not using those tools in particular, maybe we're just highlighting a word that we're going to talk about. And so we've learned some strategies as well. There's been a real big push provincially to support the right to communication. So our job was to learn about supportive communication. So some more learning, ongoing learning, right? some other adaptations that we might use. So, I mean, we've adapted to these COVID times, and we're doing them like we're teaching people how to use Zoom so we can connect with them that way. We're making sure that if we are doing a physical activity that we know what maybe some contraindications are for folks, so they're doing them safely. So there's a lot of risk management that we do in this profession as well. Yeah.
It's really thoughtful process and careful process in there. And again, yeah, well, I like that you're still like walking really a lot. And that's just going back to your message that you don't have to be expert in everything, but you have to be able to work with their different partners and collaborators and other people, colleagues, definitely. Okay, cool. And what was it that I was going to ask though? There was one thing that I wanted to, it will come back. Okay. I think it will come back. Sorry. Okay, so I think you already tapped into this next question, but I was going to ask, how do you help your clients basically negotiate or overcome their leisure-related difficulties? And I think you touched on to definitely modification, adaptation pieces. But anything else that you know very much pay attention to when you design either leisure education sessions specifically, or just day-to-day any intervention, anything that you do in your work specifically for your clients?
Well, I think the key, as I've said before, I think the key is really about patient-centered care, right? Like what they want to do. And one thing that we do in recreation therapy is we look at people's strengths. So we look at what we can build upon with them, right? We're not looking to, we don't fix people. We help them achieve their goals to the best capacity that they can. And sometimes I'll say to folks, look at like, let's go figure this out together, right? Let's go in the water and see what you can do, and we'll see if we can make some adaptations to help you do things the best that you can. And it's a journey there too. It's there's no fixed answers. There's no fixed way of doing things. It's always very individual. You know, if we have someone who used to knit, then we'll look at, and they've got, you know, some difficulties, maybe they're right-sided hemi and their right arm isn't working. So we can do some, you know, some single-handed knitting, right? So arm knitting, who knew, right? So I think it's thinking outside the box and working with the individual to figure something out. And if we can't figure that out, but we still know, for example, that it's a creative interest, then maybe we can try something else creative.
Right.
So that they can still express themselves in that way.
Yeah. Well, it's really nice to hear and see basically, you know, the action of basically what we talk about in a classroom, such as, you know, patient or person-centered care, strengths-based approach, and all that kind of stuff. Those that are, you know, in a way, it's a big buzzword that we use and we learn. Yeah, we agree that it's a good thing, but how does it actually look like? And it's you're really talking about the, you know, a bit of like a messiness, if you will, that it's not, there's no clear answer. Here's no, you know, hey, this situation, you do this. No. You have to figure out sometimes with your clients too, which I'm pretty sure takes a lot of patience, a lot of creativity, like you said. And
if I don't know the answer, you know, I'm okay to ask someone else, right? Whether it's I'm lucky enough to work in a department where we have plenty of rec therapists and plenty of TAs, but I also, you know, I it's just as easy to call upon my PT or my SLP colleague. Yes. So, you know, I think when you were asking me before about how things have changed, we used to work on an island, I think, right? We're on our own little island, and I did this and you did that. And I think one thing that has shifted is that we also work together as different disciplines to help achieve those patient goals as well. So yes.
And I also wanted to follow up a question quickly about, you really emphasize, you know, it's important to work with the individual. It's important to learn them first, you know, strengths and all. Like, So that learning piece, like how would you, I mean, we kind of theoretically learn about like little bit of API process assessment is there, you know, maybe there's something, but how you just generally go about it? Like, okay, there's a new client, you're going to learn about that person. How do you do?
Well, you know, I have students that come in and they want to learn how to do an assessment.
Right. Just tell me all about it. Right.
Yeah. And it might be one of the, you know, it might be the biggest skill to learn, because it's important that we don't come in and checklist people, right? Nobody wants to have somebody come in and like, do you like this? Yes, no. So it's really important to be able to have conversations with people and get to know them as a person, and not just checkbox them off, right? So I think that's the biggest piece is having conversations, not just completing an assessment, right? And I think when you were talking about before that the people that go into rec therapy, I think, you know, you have to be that kind of person to engage in conversations and ask questions and be able to listen and probe a little bit more. And those are the details that you kind of pick up along the way over the years of, they answer this, then what else do I need to know out of that to help them be successful? And that's the key piece, I think. Yeah.
I thought that I actually wish that you would say that, because I sometimes observe tendency that, I mean, API and all those mechanics and stuff, that's great. But at the same time, people started to checkbox, just like you said, checkbox stuff. And, but it's kind of a bit dehumanizing, to be honest. And B, it's not effective. It's not holistic. It doesn't represent the complexity of human beings and human leisure. And I think students have that sometimes mentality. Oh, this is a clinical. I gotta be, you know, I gotta have some chart. I gotta do something. And it's so great that you come in with the real world professional experiences. And no, it's actually more like a conversation.
Yeah.
That's what I emphasize in, hey, students, if we're gonna learn about leisure education, if you cannot do Zoom discussion in a good quality, you're not gonna be able to talk to your client. No, because it's stress-free. And that's why I take the class participation mark, but it's great that you know, hear that from you guys, you actually.
Yeah, I don't think there's, you know, and I think it's okay to say to people, like, I don't have all the answers, right? Because there's so many different factors in what makes a person.
Yes.
And I'm always meeting somebody new and interesting and once, you know, somebody different, right? And that's who we are as humans. So I think it's also okay for us to say, you know what, that's really interesting and that's really good. And let me get back to you. Like, I know I don't have to make decisions in the moment. I can follow up, I can do a little research, I can figure some things out, and then we can explore it together. So,
right.
Yeah.
Fantastic. Okay, sorry, we're pushing the time, but next question is, what are the challenges in your field? I'm okay, but sorry, I want to respect your time. What are the challenges in your field, the practice field, professional field, to provide a leisure education and quality leisure recreation services, therapy in general? You talked about, you know, we started from advocacy along, you know, some time ago. How do you see now? Do you face any challenges in your, you know, date? I guess you do, but definitely do. But tell us about it.
You know, I think I don't know. There's lots of challenges, right? And pressures in the healthcare field. You know, we're getting more and more complex individuals. Our caseloads are getting bigger, and the nature of our work is really very individual. So to be able to spread ourselves amongst those caseloads and make sure we're meeting the needs of everyone, and that's challenging. I think time is always challenging, and to have the time to build partnerships with our community agencies and organizations to build capacity in the community, that's always challenging too. I mean, it's just there's always something, but I think the nature of what we do is we are very adaptable. We're a very adaptable profession. because we meet with so many different individuals. So I think we can, we adapt to things and we prioritize and yeah, I think our challenges are still advancing our profession. Like you say, we still want to be clinical and recognized, but we still want to have this specialty of wellness for individuals, right? And individuals are not just their physical functioning or not just their cognitive functioning. So it is a challenging position, and but it's what keeps you going every day. You're not sitting at a desk. You're interacting with people, you're looking at new ideas all the time, you're adjusting to change all the time, and that's okay by me.
That sounds great. Well, it really speaks to the qualities that we need for a successful recreation therapist, but also leisure educator, as well as the just generally recreation leisure professional. So that's really good to hear. Adaptability, still some of the negotiation with the different disciplines. It's definitely important pieces. All right, so Kari, the last topic. So some of my RLS 331 students want to be rec therapist, or they want to be more broadly recreation recreation professional, something along those lines. They're still figuring out, which is fine. Yeah. So what's your advice for those aspiring students who may want to go to those fields? What's your advice?
Well, I think it's really important to, when I first started out, I really did a values check on why I did the things that I do, right? It's if you're going to support people to have a balanced and healthy lifestyle, then you need to think about the things that you're doing and the why of what you're doing as well. I think you have to be a really good role model in that regard. So I think that's important to kind of check that. And I know when I came out of university, I was so happy to stop reading all my articles and I just want to read a novel. And but I think the other piece, now I'm back to reading articles and making sure that I'm up to speed on things. So I think that other piece I mentioned before too, Shin, is really important. You just never stop learning, because it's it's a growth field. Yes. And that's what keeps it interesting.
So that's a great message to reinterpret that students shouldn't be complaining about my reading list. Is that what it is? No, just sorry, but it's fantastic to learn from. I mean, especially for new professional, aspiring professional, I think it's great to know someone like you are really, at the top of the manager position, supervisor positions, and you're the person who are going to, really make a, decision in the field in the next, future. So that's really comforting and reassuring to be, I think, for students too, rather than, hearing from the professional who says, those research doesn't matter, don't read about those things. It's, that's really great to know.
Yeah, it matters.
Thank you. Again, yeah, I owe you a big cup of coffee for that. Thank you very much.
Well, thanks for having me. It was a pleasure.
Yes. Okay, so we're going to conclude this. So thank you again, Kari, for doing this guest podcast style guest lecture for RLS 331. Thank you very much.
You're welcome.
Okay, I'm going to stop recording now.